Good evening, everyone. Thank you so much for joining CHOMS MediHelps Foundation, along with the Patients Rising organization in week 3 of the Black History Month series. Today, we are going to go live with our special guest. She's a senior subject matter expert. She's been 30 years in the revenue cycle management field. And revenue cycle management, you're like, Sandra, break that down. Exactly what the heck is RCM? So, revenue cycle management is all things financial when it comes down to your medical provider, whether it be medical billing, whether it be claims, whether it be medical debt. And in the news lately, a lot we're hearing so much information about medical debt. Well, what is medical debt, right? And is it really medical debt, or is it something that you just need to know that you need to be mindful of so that you yourself will be able to, handle it and be able to stop it? And, what is it, right? So, and this conversation is going out to all communities. However, because it is Black History Month, this discussion tonight is going to be driven towards the negative impacts that we in the African American community feel when we get a bill, or feel when we go to the doctor's office, or feel anytime anything medical is involved. So without further ado, I'm going to sit back because once again, when we do these educational series on Wednesday, there are 3 PEs, I call them, will be discussed. That's patient engagement, patient empowerment, and patient education. And you cannot be engaged and you can't be empowered if you're not first educated. So, Ms. Ruby, I'm turning to you. And go ahead, girl. The floor is all yours.
Hello, everyone. My name is Ruby Simmons, and I'm your medical billing mentor and owner of Blossom Revenue Cycle Solutions. And today I will be talking about medical debt, what it is and what it is not. And I will also be educating you on ways that you can help clear up medical debt and work with your provider to assist you with your medical debt. So what I would like to do in the beginning of this conversation is talk about what medical debt exactly is. Medical debt refers to the debt that an individual incurs as a result of paying for medical expenses. It includes hospital stays, doctor visits, prescription drugs, and other health-related costs. This type of debt can arise from a very varying factors, such as high costs for medical procedures, lack of insurance coverage, or high deductibles and co-pays. The burden of medical debt can be significant and can impact an individual's financial stability, their credit scores, and overall quality of life. In many cases, people may struggle to pay off medical debt, and it can lead to serious financial consequences, including bankruptcy. Medical billing is a complex and often confusing process, but I do my best to provide a simplified overview for patients. When you receive medical care, your healthcare provider will generate a bill for the services provided. The bill includes a list of the procedures, treatments you receive, as well as the cost of each service. If you have health insurance, your insurance company may cover some or all of the cost of your medical care. In this case, your healthcare provider will submit a claim to your insurance company on your behalf. The insurance company will then review the claim and determine how much of the cost they will cover and how much you will be responsible for paying out of pocket. The amount is usually based on your insurance policy and may include deductibles, co-pays, and co-insurance. If you do not have health insurance, you will be responsible for paying the full cost of your medical care. Your healthcare provider may offer payment plans or financial assistance programs to help you manage the costs of your care. It's important to keep track of your medical bills and review them carefully to make sure they are accurate. If you have any questions or concerns about your bills, don't hesitate to contact your healthcare provider, especially their billing department and your insurance company for assistance. But there's a lot of other programs out there that a lot of people at times do not realize that they may be eligible for. At times, people think that, oh, I applied for Medicaid last year and they turned me down, and I'm not going to apply again because they're probably going to turn me down again. The thing with Medicaid is that when you become ill and you start creating medical bills, it changes your situation. And you may find that you were not eligible last year, but this year, due to the medical debt that you have incurred, you're now eligible. So never turn down or think that you're not eligible for a program. I say always apply for every program that you think that you are not eligible for, because the worst thing they could ever tell you is no. And the best thing they could tell you is yes. So just give it a try and search for programs out there that help you to find donors that will assist you in paying your medical bills, and other programs out there that will help you in trying to get your medical debt written off. So never give up on trying to get your medical bills covered. And a lot of times with certain organizations, they don't always take you to collections. They will give you financial assistance and assist you in your situation, even if it's writing off half of your bill and then setting up an affordable payment plan for you. These are things that you need to know about, and you need to verbally ask for it. Never be ashamed to ask for financial assistance. Verbally ask when you know that you have bills or you know that you don't have insurance. Ask, is there a way for you to get help? And have them refer you to a person in their billing office. Have them refer you to a social worker. A lot of times, if you're admitted into a hospital, there's a social worker on the floor that is willing to help you and set you up with someone else, sometimes a patient advocate, to help you understand the services that you're getting, the services that you have had done, and the bills that may come afterwards. And then they'll work with you after you are discharged out the hospital or left the hospital, and they'll assist you in getting your bills paid. So just remember that just because you don't have insurance or you've been denied for services or Medicaid or any kind of financial assistance previously doesn't mean that you will be denied again. It's very important to understand this. But what I would also like to talk about is understanding your bills when you have insurance. And one of the most important things you need to know or to understand when you do have insurance is that the contract between your insurance carrier and you is between you and your insurance carrier. That means that it's very important for you to understand your policy. And what comes with that is that you need to understand what you be responsible for out of pocket from your insurance carrier. Because just because your provider bills your insurance carrier does not mean that they're responsible for the balance after your insurance pays. If your insurance has applied responsibility to you, like copay, co-insurances, deductibles, and other out of pockets. Let's say you have a procedure that you needed to have done emergent, but it's a procedure that your insurance may not cover, and that means that it may be your responsibility. It's up to you to understand how your insurance would cover those types of services. So just signing up for health insurance and saying I have coverage is not all you have to do, and it's not all that you're responsible for. As the patient and as the person who has the insurance, you are responsible for understanding your insurances. And a lot of times, patients think that insurances, the providers will allow them to write off the balances after insurance. And in some cases, they can't do that because the provider also has a contract with the insurance carrier. And in that contract, it says that they have to collect co-pays, insurances, and co-insurances, and any out-of-pocket balances from patients. So they can't just write it off. They can set you up for a payment plan, and they may be able to set you up for financial assistance that will help assist you in getting all of your bills written off, but it has to follow a law. I think it's called a 403B or a 501C law that it has to follow, and that's basically a financial law that every hospital and provider has to have in place to assist patients financially with balances after insurance. And one of the other things that patients need to understand is that they need to understand some of the laws out there that have recently come out, like the No Surprise Bill law. And it's also known as the No Surprise Act. And it's a piece of legislation that was passed in the United States aimed at protecting patients from unsuspected or unexpected medical bills. This law is designed to protect patients from receiving surprise bills for medical services that they did not expect to receive, or for amounts that they did not anticipate. Under this law, patients who receive medical care from out-of-network healthcare providers or in out-of-network healthcare facilities are protected from receiving surprise bills. This means that patients are only responsible for paying their expected in-network co-payments, deductibles, and co-insurance amounts.
And Ruby, I do have someone that's actually brought up a good point. They're saying our community health center has a sliding fee scale. Most community health centers, because they do, well, I'm going to let you discuss what a sliding fee scale is and why is it that community health care centers are able to offer a sliding fee scale.
Well, community health centers, a lot of community health centers are nonprofit organizations, one. A lot of them live on grants, and a lot of them get assistance from the government. So sliding fee scales are they fall under financial assistance, and they're not a payment plan. Basically, what a sliding fee scale is they say, what's your income, and you give them information on your income. And based on your income, they lower the amount of the services that you're getting, and you have to pay a certain amount. So let's say you're getting a service for an office visit and it's $350, but based on your income, you only got to pay $75. That's a sliding scale because it's based off of your income. And they're saying, and these kind of sliding fee scales come in instances where people they make too much to get Medicaid, to be approved for Medicaid, or any other financial assistance programs that may be out there. So if they're not indigent enough to get Medicaid or any other financial assistance program, sliding fee scales are used in community centers to help patients pay for services and get services rendered. When I worked for an orthopedic organization, we referred a lot of patients out to community centers for services where, let's say they had an automobile accident and broke their arm. So when they came in and was seen, their services were emergent. So the services had to be rendered. But once the service is no longer emergent, the doctor does not have to see you again. That means you may not be scheduled for a follow-up visit. They will send you to a community center to get your services rendered, because at the community center, they'll give you a sliding fee scale. They may even see you for free. They will remove your stitches. They will see you and make sure that you don't have infections. They will set you up for another visit. They will try to assist you in getting any pain medication or infection medication that you need. But you have to understand that as a person that may not have insurance, when you are receive services where you've had an accident and you're seen emergently, that any follow-up visits that you have afterwards, your provider does not have to see you, because the service is no longer emergent. So if you are seen by that particular provider again and the service is rendered, you're going to get a bill. You're going to get a bill, and then you're going to have to try and figure out, well, how am I going to pay this bill? Like I said, most organizations, they have to have a financial plan in place to assist patients. So you still have the ability to do that. But sometimes the financial plan that they put you on still has you paying money, and you're trying not to pay money because you know that on top of the bill that you already have, on top of your living expenses and trying to get to work and feed yourself and feed your kids, that you're not going to be able to make these bills. It's best for you to see if you can get Medicaid and get into another program. But if not, that's the only other route you can get into, is going to a community center and applying for sliding fee scale, or trying to get some type of financial assistance in the organization you were seen at. And I hope I answered that question thoroughly.
I do believe you did. And so before we wrap up for the night, I actually just want to give you the opportunity to give your contact information in case people should have questions where they want to, reach out to you. You have your email that people can reach out to you to ask you questions, because while we covered tonight medical visit at a doctor's office, there's a whole lot more when we're talking about medical visits or outpatient and inpatient hospital care. So I'm certainly hoping to have you back with us in the near future, so you can go ahead and give us, the tips that you have to give us for what do we do? What's the flip side to the community center's sliding fee scale at a hospital? What's that called? How do we get in touch with them? What do we need to do if we get a $50,000 bill and we just really understand why we have a $50,000 bill? So I am hoping that I can get you back really soon so we can discuss some more what we need to know. Well, how we in the African American community and how we as patients can avoid, being stuck in medical debt and being stuck in medical collections. And as one last thing that I would like to add before I have Ruby close us out is this. Please use your voice. Please use your voice. If you're getting a bill from a doctor and you're not sure why you're getting this bill, or it's a bill and you can't pay it, the doctor can't read your mind. So they can't help you things that they are not aware of. And as a patient, we have to be empowered enough to pick up the phone, to type an email and say, hey, I need help with paying this. What resources are available to help me pay this? So without further ado, again, Miss Ruby, I'm going to go. And if you do need to reach out to Miss Ruby and you don't have the time to write the information down on how to contact her, please send me an email at contactus@medihelps.com, or send me an email message, DM me and say, how can I get her information so that I can get you her information. So Miss Ruby, with that beautiful smile on your face, can you please close us out with all the love that you have inside of us to helping us as far as these medical bills are concerned?
You can contact me on IG at Blossom RCS LLC. You can also contact me at Ruby at blossomrcs.com. And you can go to my website at blossomrcs.com. And once again, I'd like to say that, when you get into a situation where you have medical bills, it's very important that you speak to someone. It's very important that you do your research. Don't get overwhelmed and just in a rut and depressed thinking that you have to pay all of this money. Even though my entire career has been revenue cycle management and medical billing, I am not just a provider advocate, I am also a patient advocate. And I assist patients to work with their doctors in helping them to clarify and rectify their bills, because really the doctors don't want you to just stay in debt and not get services rendered. I've come across too many patients that would not come back for visits because they didn't want to pay for their deductibles and they didn't want to pay for their co-insurances or anything like that. But it's very important for you to get your care. Get your care, and then we will help you to figure out how to get payments. And in the Black community, that happens a lot. It happens a lot where we don't get services rendered because we're scared of making a bill. And your life is more important than a bill. You can get past the bill and you move past that bill and live life again. That bill is not going to be there for you forever. It doesn't even stay on your credit forever. Trust me, get your care. It's very, very important. And yeah, I would love to come back because there's so much more I would really like to share about medical bills and how to get assistance paying your medical bills and how to understand your bills. They have a book out there, Never Pay the first bill, uh, and that's very true. Never pay the first bill. Always call and get an understanding of what the bill is, even if you have to call your insurance. Always go somewhere and see if you can get assistance. I'm not sure on if everyone has access to the internet. You could go to your local library in different places and look for people online that will assist you, on IG, on LinkedIn, on Twitter, anywhere. You never know where you will find the people that will help you, because we are all out there and we're all looking to help you. And not all of us charge. A lot of us do it for free. So always say something. And thank you again. My name is Ruby Simmons. I'm your medical billing mentor. And I am very happy to have had this conversation with you. And again, if you want to reach out to me, you can hit me on IG on Blossom RCS LLC. You can email me at Ruby at blossomrcs.com, or you can check my website at blossomrcs.com. www.medicaldebt.com. Have a wonderful evening, everyone. I look forward to talking
Thank
to
you,
you.
Ms. Ruby.
You're welcome.